allowing us and inviting us here, and also and Dr. Murali and Dr. Sanjai and all the team of AINU. We consider it a privilege to be part of doing this program here and also service here. I'll just take very briefly a few minutes, but just give you a few points since there are a lot of press also here. So you must be aware of the fast tag. Fast tag, what you see in toll booth. So the fast tag is also part of JOGO. And similarly, you must be using a credit card, tapping the credit card. So the tap technology is also contributed by Sanjai. So technology-wise, a lot of things are being making of JOGO. So I think Mr. Sanjai has already shared these things. So we are based out of New Jersey in US, and we have operations in India, Canada, and Malaysia. We have Sanjai, the founder, and also Shilima Raja, the co-founder. And what is JOGO device? It's an AI-driven device with wearable sensor. Basically, it's a big, bulky, old dynamo TV type of machine, which has become into a small wearable sensor. And the beauty of this is, it also works virtually. We treat around 20 countries sitting from Chennai. So we ship the device to the patient home, and using virtual platforms, we are able to treat. And it's FDA approved. And these are the two founders. The name JOGO comes from two founders. One is Joseph Bradley, which Mr. Sanjai mentioned, a neurologist come physiatrist, and Gordon Silverman, who is the inventor of FastTag, which we call in the US as EZ Class 2. So basically what the difference is, it's portable, so we can carry it anywhere. It's as small as this, which we'll show you in subsequent slides. Non-invasive. The previous EMG was a needle in EMG, and it's digital, and it works real time with no lag time. I think this slide has already been shown. So basically, we rewire the brain with the help of neuroplasticity. So this device is more like an enabler. It's just like a thermometer showing the temperature. It tells the muscle strength, and the beauty of the device is it can go up to 1,000th of a millivolt. In fact, almost November last year, I was invited to the Apollo Indraprastha Hospital. So we did a demo there to the head of rehab, and they showed that we also have biofeedback. So how is it different? But when they saw our device, they said these are minds apart. So I'll just show a small demo of JOGO.
JOGO is a prescription digital therapeutics company to treat neuromuscular conditions. JOGO is an AI-driven device with wearable sensor applying the science of EMG Biofeedback, facilitating neuroplasticity.
And we attach this on any part of the body where we want to measure how the muscle is working. So the surface EMG can be applied on all superficial muscles. This is our sensor, and this is our own patented product. With this, we are able to see the output on a tablet screen. So therefore, we call it as a digital therapeutics. We use alcohol swabs to prepare the skin, and it also reduces the skin resistance. For the sake of demonstration, I'm going to do it on the wrist extensors. I connect the electrodes to the lead and then stick it on to the part of the body. I connect this with a strap. I click on the JOGO app and update the patient information. So the tablet is connected to the sensor by Bluetooth. Up, down, up, down. Now what you can see is that this is giving a real-time feedback to her. As and when she is lifting it up, you can see the graph going up. When she comes down, the graph comes down. So I'm going to take a screenshot of this. This is a frame where I have captured a response, and I can always send it by email to any person. The biggest advantage of JOGO is that if the patient is completely active, as they move, they are able to see how the graph is changing, as well as objectively measure their own performance. And this serves to motivate the patient, because now the person is able to understand how much the intensity of output they are able to generate and where they are. As I have mentioned earlier, you can always compare previous performance with the current performance. JOGO has three main advantages. Number one, it is assessment and tracking. We can always identify what is their baseline, and then I'm able to track it because I can take a screenshot. I can always compare yesterday and today. This graph serves as a reinforcement of motivation both to the patient as well as to the clinician. Number two is validation of the treatment. We can validate the exercise by using JOGO and telling the patient do the same thing with and without support. And with the help of JOGO, we are able to understand how the patient is responding because this is totally customized according to that particular patient. The third advantage of JOGO was the biofeedback, where the person had a target, they were looking at the line and they were trying to touch the line and then come back, where they learned to control the amount of muscle activity. So this is a way in which we can use it as a biofeedback, and we can also say this as a EMG guided exercise.
So these are two benefits. This is just a patient recently treated in Tremors. She was suffering from urinary incontinence almost 36 years. She used to wear almost 4 to 5 diapers a day. And after 10 sessions, in fact the first session when she came, when we laid her on the bed, the entire bed was wet with urine. From there, after 10 sessions, she completely walked without any diapers. And today she is living with just one diaper when she goes for travel, otherwise she is completely well. Like this, we have treated almost 2,000 patients in pelvic floor disorders. And the oldest patient we have treated is 90 years old. The youngest patient is 5 years old. In fact, we are doing a bedwetting study in child trust. In fact, also we are having a lot of promise in gastroenterology also, like what Mr. Sanjai mentioned in wrestling lubrication. In fact, we are doing a study post LAR also very soon. So these are the kind of patients we treat. And I think these are some benefits. We are US FDA approved, and we also got a special status called breakthrough device, which is given to 1% of all devices, especially for chronic low back pain, which means there is no parallel with JOGO. And we are, our AINU clinic is JCI accredited. In fact, in one category, under ambulatory care, we are the world's first digital rehab. And we have clinical partnership with Harvard, Mayo Clinic, and these are the conditions what we treat. I think it's already captured. And we work with hospitals, corporates, the geriatric care, home visits, telemedicines, and doctor clinic. And today we are present in 10 cities. We are on, even as I speak now, our colleagues are treating in Medanta, Gangaram, and all the major hospitals across the country. And these are some hospitals where we have tie-up, where we go and do service every day, or weekly, 2 days, 3 days, etc. across basically Chennai and Bangalore, and now we start operation other parts of the country. And we also get prescriptions or referrals from many hospitals across the country. And I think it's already shown. We are also under insurance in the US, and very soon we are trying in India also. And just something very interesting for, if you look back at 1999, 98, mobile phones came and disrupted the entire, the technology, and today it's affecting the entire world. Similarly, digital health, the size of the market is around 200 billion, and the next 10 years is going to become 800 billion with a growth of 16% CAGR. And US is going to grow in 1.5 times higher, it's going at 25%. And this is not just restricted to one particular therapy, but across all specialties. You can look at diabetes, obesity, smoking, etc. And like us, there are 3 lakh companies across the world which are going to come very soon, and this is going to change the entire landscape in healthcare. And there is an estimate that says with 2035, pharmaceutical drugs will be overtaken by digital health. So that's the kind of thing we do. And in 2021, US FDA gave a special ruling that if a drug is going off patent, if you combine it with digital therapeutic, you can extend the patency. So a lot of pharma companies are already tying up with a lot of digital therapy companies to extend the patency. And as you all know, that life expectancy is increasing in the next 10 years from 71 to 84, and that is where lot of issues come, and we see urinary incontinence as a major issue with people after 60 years, 70 years, and after 70 the incidence is almost 70%, and above 80 it's almost every patient. And we are also doing some studies, as Mr. Sanjai mentioned, and this is how the patient journey comes. When the first time he comes, we do a thorough assessment which goes for 1.5 hours, 75 minutes to 90 minutes. And then the session starts, and on day 1 we give a report to the referring clinician, and again midterm, and then on the end on discharge. And we also have a comprehensive integrated patient care, so a lot of touch points for the patient. We give a bladder diary, we give a nutrition support, we also give a psychologist, because many patients have anxieties. Then we also have speech therapy for, of course, not in urinary incontinence but in gastro. So we have a team of almost 50 therapists across the country, and all of them are trained. The head of the operation, head of pelvic floor is Ms. Uma Venkateshan. She's been trained, she's been doing pelvic floor therapy from 1986. She's been treating more than 6,000 patients. She's a regular speaker in all the urology and gastroenterology conferences. And I'm sure that together we'll be able to impact more patients to live a life without diapers and without pads. Thank you.